Hi everyone, my name is Bonnie Acosta and this is my dental hygiene for infants and toddlers for COM 113, California Baptist University. Thank you for joining me. But before we get started, I wanted to ask you a question. When do you believe that you should brush your child's teeth for the first time? Do you believe it's when they have a full set of teeth? Do you believe that when your child gets their first tooth? How many believe that when they're infants, that's when you should brush their teeth? How many believe that? Show of hands. If you chose when your child is an infant, then you chose the right answer. And I'll tell you why. So why brush your baby and infant's gums and teeth? Well, baby teeth are very important to your child's health and development. They help them chew, speak, smile, and they also hold the space in the jaws for the permanent teeth to come in. That's why starting infants off with good oral care can help protect their teeth for decades to come. According to the CAP study that was done in India, they stated that the parental perceptions about early childhood oral health are important to develop effective preventive measures since parents' health, beliefs, behaviors, and practices usually have a direct influence on their children's dental health. What this means is they suggest that you be a good role model for your child. Why is it important to brush your infant and toddler's teeth? Well, it helps promote healthy habits. And according to the American Dental Association, you should always clean your infant's gums after eating. Use a moist gauze pad around your index finger to clean your infant or toddler's gums. Okay. Infants normally begin teething between 4 to 6 months of age, and they can become red and swollen. However, if you see puffy, swollen gums, maybe bleeding, maybe redder than usual, these are symptoms of gum disease. And according to Rabari, for the Knowledge in Health article, oral health education during and after pregnancy should be beneficial to promote healthier mouths for mothers and their children. I agree. I agree. How we brush our teeth will determine how our sons and daughters brush their teeth also. And it's good to be a role model for that. It's good to have healthy teeth. So another study that was conducted in Florida, talking about tooth decay, dental decay, out of 51 mothers, and make sure that I get my statistic right, out of 51 mothers, 24 mothers reported to brush their toddler's teeth only twice a day. 24 out of 51 mothers. That's only 47%. 20 mothers brush their toddler's teeth once a day. 5 mothers few times a week, and 2 of the mothers never brush their toddler's teeth at all. I can't even imagine. I brushed my son's teeth twice a day. I also took them to the dentist every 6 months, even though I was very scared to go. But I have to put my fears of the dentist aside, and I had to be a good role model for my son. So every 6 months, they got their cleanings, they got their cavities, they got checked out. I made sure of that. Speaking of the dentist, when should you take your toddler to the dentist? Well, it says that after the first tooth comes in and no later than the first birthday. I have always thought that we had to wait till their third birthday, but according to the American Dental Association, it says that visit an early baby checkup for their teeth is important, and it gets them into the habit of going to the dentist as early as possible. When you go to the dentist, ask a lot of questions, because besides checking for cavities, they'll also see if they have any other problems, and the dentist can show you how to properly clean your teeth, because that is a problem. When you don't know how to properly clean your child's teeth, then they will not know how to properly clean their teeth. Can we have good oral habits? Can our children have healthy teeth? Yes, they can. First, by being a role model and establish good, healthy oral habits. Shop for healthy foods. Make better choices. According to the PLOS-1 study, found that children from low-income families have more cavities than children that were not of low income. Well, they noticed that the low-income families did not eat healthy because they said that they could not afford it. As a very impoverished young mother that I was, and believe me, very impoverished, I used my food stamps very wisely. I made sure that I bought healthy foods first. If we couldn't afford the cookies, then we didn't eat the cookies. It was just that. It was as simple. I'm hoping that other mothers around the world understand how important healthy eating, healthy diets are for your child. During pregnancy, a mother needs to not only visit the dentist while pregnant, because if you develop an infection while you're pregnant, it can go down to the baby and it will be affected. That's why I believe that all mothers should ask about dental and oral health care while you are pregnant and get information from your obstetrician. This is very important. I hope everyone enjoyed the speech that I had today. I might have run a little long, and I apologize for that. After the speech, of course, there will be food and beverages in the other room, and I thank you for coming, and I want you all to have a great week and a great weekend. God bless. Thank you.